So this patient's coming in. She was originally booked for removal of a cyst, and you can see what's happened over the course of the last couple of weeks. This has become inflamed, and now we're in a case where it's inflamed/infected. So we can no longer remove it entirely. What we're going to have to do here is, you can see how these are breaking through. We're going to try and add some freezing to this so that we can open this up. We're going to have to express this and clean it out a little bit, and then allow that to settle back down so we can go back in and take this cyst out properly down the road. Now, unfortunately, because this field's infected, the anesthetic may not work. So why does the anesthetic not work in these settings? Do you remember?
Basically the pus will change the pH, make it more
Yes.
acidic.
So it's all pH based, and when it's acidic, the lidocaine is ionized and it can't get into the cell, and so it doesn't function as well. So we'll have to sort of see how we do. So in these cases in particular, I mean, all of them you want to try and be as superficial as possible, because if we're into the actual cavity, you create pressure and that hurts the patient. Sometimes you can't help it because it's so superficial, but we want the bevel to be up so it's as superficial as possible, and we want to see this blanch as you know, as much as we can. So I'm going to try and add some freezing in right now.
Okay.
And we explain this to the patient ahead of time that it may not take very well. Little poke here. You okay?
Mm-hmm.
Yeah, it's going to grab you a little bit. So you see how that blanches? That's what we want to see, just like that.
Mm-hmm.
And I'm going to want to extend that through. You okay?
Mm-hmm.
So as much as possible, we want to see. Now this is an area that's broken down, so I want to try and see if we can freeze that. You okay?
Mm-hmm.
Now you can ask yourself here, what about just doing a circumferential block all the way around? The difficulty is it's hard to see where the infection starts and stops, even though you think that visually it's just right here, but that's not always the case. So even those blocks don't work as well. So it just makes things a bit complicated for us.
Mm-hmm.
So once this is in, so we're going to see if we can open this up a little bit. How does that feel when I push there?
Okay.
Not too bad. So just have lots of 4x4s available. This is our number 11 blade. Feel a little pressure here. You okay?
Mm-hmm.
So this is what we expect. It's going to be a combination of pus, and if there's some solid material, it'll be the keratin that's not quite broken down. You see a little bit that's there. This is why you always want to have lots of 4x4s available. So again, mostly pus. So this is where, again, I won't send this away, this portion for microscopy. We'll do a swab after the fact, but if I swab this stuff, it's just dead cells, so it won't grow anything.
Mm-hmm.
You okay?
Yep, I know, it was just interesting what you were saying, because I worked in microbiology.
Oh, did you? Yeah.
I retired from the lab.
Yes, you know we sent you all kinds of bad samples. That,
In the past,
yes.
yeah. Oh,
Yeah. So you can see there, that's keratin. So this is always the differentiation. Is this an abscess or an infected cyst? And this would be an infected cyst. Yeah, it's just need more 4x4s. You're okay there?
Yeah.
I'm almost done with this portion. Now once I've done that, I'm going to use a curette, and if she tolerates, I'm going to see if we can break down adhesions. You okay when I do that?
Mm-hmm.
So this is always a balance, because anesthetic's not fantastic here. Yeah.
Oh.
Yeah, and that's why I don't want to do a lot of it. Now you can alternatively, some people will use a Q-tip, and you can do that as well, but really if the area is not anesthetized, it's going to be sensitive no matter what happens. So in these cases, I'm going to want to syringe this out, and then we'll pack it so that we get the chance that if there are loculations that we haven't broken down, that it can collapse into it overnight. See, it drains a little bit more since we've done that. Just like that. Is there a swab line, Greta?
In the bottom door on the phone. Yeah.
So this I want to do once I syringe it.
Mm-hmm.
So just hold that there for me.
Mm-hmm.
So this one, this is sterile saline. We just want to be irrigating this. This you want to be moving around a little because you want to infuse the old cavity. You okay?
Mm-hmm.
So we want to clean this out as much as possible. Very good. Let's grab your fork
Yep.
there.
That's perfect.
So you just want to be shifting this around because you're trying to irritate the walls of the capsule and get some more debris to break off as much as we can. Very good. See, now it's at this stage that I'll actually do a swab for microbiology. So here we want to just scrape the wall here. And again, I always tell residents, it's like if you were trying to interrogate a soldier. You certainly wouldn't interrogate a dead soldier. You want to find somebody who's alive and then interrogate them, and that's what microbiology is like. So we're hoping that we find a live bacteria along the side of the wall, and we'll send that off.
That's about it. Almost like a tip anyway.
This may not pack as well. You okay?
Mm-hmm.
So packing is something that we used to do a lot more of. We used to do this for weeks and weeks. Now we typically just do this overnight. So there's anesthetic in right now, so it's not terrible putting this in. That's not too uncomfortable for you?
No.
But when there's not anesthetic in, this is uncomfortable, and that's why they've gotten away from it, because they don't find it actually helps healing. But I want to do it in this case because the anesthetic wasn't great. We weren't aggressive with the actual curetting to break down adhesions. So this will allow pockets to break down into the actual central cavity overnight, and then we can take this out tomorrow, and then we'll just let it heal from there. You're still okay?
Yep, just takes a bit.
Just like that. And here what we do here is, so I'll cut it at the superior end before I get my scissors dirty. And I'll leave that there. And then down here, I'll cut it. And so now if it does get dirty with the scissors, I haven't compromised this. So now we'll just dress this up and we'll see her tomorrow.